Netsmart's an organization that's been around for over 50 years. We provide a continuum of services, applications, and technology. Traditionally, most people think about it as an electronic medical record or electronic healthcare record, but really we've moved well beyond that.
Within Netsmart, the EHR is one component of the platform that we deliver, which is the Care Fabric platform. That platform provides kind of the operating system for organizations that they can do everything from the initial intake to the documentation that is required for the care that is delivered, all the way to the transformation of that into claims and billing and the collection of the revenue.
When we think about the impact that we're making, it's easy to get into speeds and feeds as a technologist, but it's that life, the human-centric, the person-centric focus that makes the most difference. We're impacting over a third of the population in the domestic US alone, and that's only growing. Providers need more time. They need to be less about what they do for systems and more about what systems do for them.
Out of a 5-day work week, they're spending 2 days on documentation. That is a massive amount of time. If we can automate as much of the clinical documentation as possible, then we will do that. What that ultimately turns into is clinicians are able to focus on their clients, their patients.
You know, our partnership with AWS started and formed with a vision. I think many times people will look to organizations such as AWS almost in a vendor mindset. We didn't want that. We wanted a partnership. We wanted someone that we could connect and collaborate and innovate forward with.
One of the things that we knew we needed was this ambient listening capability. They have a product called HealthScribe that we knew we wanted to leverage. And so we've been working with that team to introduce behavioral health capabilities into HealthScribe. You can record what is happening between the therapist and whoever else is in the room. It's going to capture all of their voices independently, but also be able to quote what they did, how they said it, and then document what the clinician ultimately did in that session. And so it'll be a huge time saver. Not only is it a partnership where we're able to use their technologies, but we're actually helping the HealthScribe team come up with more behavioral health expertise that is really a huge benefit to both sides.
Our healthcare providers spend 40 to 60% of their time on documentation. What we've been able to do in this partnership is to look at that 40 to 60%. We've given over half of that time back in the tools and the solutions that we're being able to provide our clients. Not one of us could have done it independently. It's us coming together collectively that we're able to make that happen.
So one of the awesome things about working with AWS for the generative AI side is they have a capability called Bedrock, which not only allows us to use their AI solutions, their large language models, where AWS is slightly different than a lot of the vendors out there that offer services, is they allow us to change models kind of as needed. It just really accelerates everything we do from the engineering side.
The solutions that we've provided with the partnership with AWS really allow us to look at things a different way. So oftentimes in the past, the EHR was really a tool to collect information. We can finally turn that around and provide more insights back to the provider. We can understand what's happening and the trajectory that's happening with an individual and start to predict things. We can predict if an individual has a risk of hospitalization so that they can intervene quicker and hopefully keep them out of the hospital, providing a cost savings from the system's perspective, but also getting them the right care that they need at the right time.
Most partners are just there to sell the services. AWS has a different philosophy. They want you to be able to use those services, but also use them at a very high level.
The AI Data Lab was kind of a first-of-a-kind partnership that we did with AWS, providing a central place that allows all of our engineers access to the tools like Bedrock and HealthScribe, SageMaker, so that we can quickly and easily start to experiment.
This collaborative effort is about AWS coming and say, have you considered this? Or what if we architected in this such a way? It's our client saying, hey, this would work. It's Netsmart saying, we've been doing this for 50 years. That threefold effort is delivering not just solutions and services, it's delivering value. And that value is measured in time, it's measured in outcome, it's measured in experiences.
One of our bigger philosophies is when you hear AI, we don't think of it as artificial intelligence. We think of it as augmented intelligence. The reason for that is we don't want to replace the clinician. That is never going to be our mission. We're just there to help and assist them and just make their life easier.
And now with AI, we can take a lot of the data that we've been building up in our client solutions to really start to provide insights and transform how they can deliver care.
I'm proud of our partnership, not just because of what we've been able to produce, because it's making a difference in the ecosystem we serve. Healthcare has been a payment-centric focus. This is about making it a person-centric focus. It's a universal language. Our quality of life and experience is directly tied to our healthcare experiences.